My name is Christine Baright. I'm a physical therapist here at Duke, and I work at the Duke Diet and Fitness Center. One of the things that I like most about where I work here at Duke is the fact that every day is a little bit different. I treat a lot of geriatric folks with a variety of problems. My day can also include some time in the pool doing aquatic therapy. Sometimes chronic pain, sometimes post-op recovery, or balance and gait training. And then I also am the site supervisor and run the arthritis program, which we treat obviously of folks with arthritis, but we do a structured group exercise program, and that also includes a pool class. In working with patients, I think especially when I meet them the first time, I like to get a really thorough history with patients so that I have a glimpse into their day-to-day life, to figure out where maybe their pain is limiting them from their day-to-day tasks. Maybe it's a fact of being unable to care for their grandchildren. Sometimes it's returning people to sports and activities that they like to do. Sometimes it's getting them back to their job that they want to be able to get back to and be productive. So a lot of it's just listening to the patient and finding out how functionally what's happening with them physically is impacting their life. I think what I like most about my work as a physical therapist is that I do get to treat the whole person. So even if I had somebody who had a referral for a knee pain or a particular joint problem, I do try to take into account that everything that they do day to day is affected by what I'm seeing them for on an impairment level, but really look at their function. And I think the biggest thing is that I pride myself on looking at the whole patient and the whole person.